With the advancement of the treatment of various diseases, there is an increase in the population which is immunocompromised. Now we have more patients who are being given chemotherapy. There are more patients who are being transplanted. So there is a rise of this population which is called immunocompromised because they receive immunosuppressive drugs. And because of all this, few of this population becomes prone to infections of various kinds. And I think pulmonary infection is one of the commonest infections these patients suffer from. So we have Dr. Bansal, who is the senior consultant in respiratory medicine and critical care at Indraprastha Apollo Hospital. So Dr. Bansal, so what are the challenges in diagnosing infection in an immunocompromised host?
I think it is really challenging for various reasons. I think one of the commonest reasons is that these patients are very prone to infection, especially multiple infections. So you may diagnose one, the patient may still not get better because he has another 2 infections which you did not diagnose.
So you mean to say they have multiple infections?
Absolutely. So that's number one. Number two, sometimes when you feel it is infection, it may not actually be infection, it may be a non-infectious problem which you have not been able to diagnose. The fever could have been because of a hemorrhagic syndrome or a disorder or BOOP which you thought was infection but it was not infection.
So what are the common non-infectious lesions you see in these? One you said BOOP or hemorrhage.
One of the commonest thing is probably pulmonary edema in such patients because all these patients are sick, they may have cardiac disorders, they may be in uremia, they may have hypoalbuminemia, so they tend to go into pulmonary edema very quickly and they tend to have these multiple shadows which are misinterpreted as infection. So that's one. Pulmonary alveolar hemorrhage is another one, BOOP is another one. Then extension of the disease per se, that's lymphoma. I mean you thought that this was a new infection but probably it was just lymphoma spread into the lung which is causing.
So I think once a person has a fever or a new shadow, the first question one should ask is that whether it is non-infectious.
Absolutely.
So what are the other challenges you feel?
Well, I think the biggest challenge is to really think that there is some problem going on because these patients are immunosuppressed. Most of the symptoms are delayed because of muted immune response. When they reverse actually, then they start getting into fever, cough, multiple shadows, and then you actually realize that they have infections and by the time sometimes it is too late. So that is one problem, that the presentation is delayed and the identification of these infections is also delayed simultaneously.
So basically these patients have multiple infections, they have non-infectious